Greetings from Thessaloniki, and I would like to start by thanking Professor Konstantinos Makris for the honor to include us in this very interesting webinars of Children First. Let me share my slides. Okay, Konstantina, yes, please let me know if, okay, great. So, in the first part of this webinar, I would like to share with you our experience and giving a very brief outline of what will follow. I will start with giving you very briefly what is the national action against childhood obesity that takes place in Greece, and what are the food for action toolboxes that we will be talking about. And at the second and more and larger part, I'm going to describe to you how were the universities involved in the promotion of healthy eating and physical activity at the community level. So, Konstantinos has started by giving you the dark picture that unfortunately both Cyprus and Greece are at the first place when we are talking about the prevalence of overweight and obesity in childhood. And this is happening for some decades now, so it was time for action. Based on all these statistic findings, the Ministry of Health, Greece, has decided 3 years ago to start an intervention based on the WHO people-centered care model, trying to see how it can influence through a national action the person, the children, the family, the community, and again, all this within the wider picture of what's happening in a neighborhood and, of course, in the health sector. Many different things are happening through this national action. What I would like to focus more on is what is happening in terms of how can something be developed that could make a change in the long run. How can something be created, a tool that can help at the time being and also have a continuity. And what was decided was to create a toolbox that is available through web. It is free, of course, for charge for everyone. And it provides valuable information about teachers, about parents and guardians, and of course, about our students. So based on 5 target behaviors that are associated internationally with obesity, and I'm talking about drinking water, sitting time, having the appropriate breakfast, and healthy choices in between meal snacks, and increasing physical activity. These were the 4 target behaviors on which building the toolboxes Food for Action was based. If you look at the web and Google the toolboxes Food for Action web page, which is available through the Ministry of Health of Greece, it is in Greek, of course, you will see that these toolboxes exist for teachers, and actually they are divided according to the level at which teachers teach. So they are for nursery and primary school, for middle and high school, and there is also available some asynchronous training for teachers. There are tools available for parents, again, according to the age of their children, and also for teenagers. So giving you very briefly an idea of what does Food for Action means and what are these toolboxes. This is something that was created and it's here to stay. And it was one of the things that the ministry wanted to use in order to increase awareness in the community about healthy eating and physical activity. So this is where the universities were invited to contribute. So they divided the whole country in 13 different areas, and they have invited 30 different universities all around Greece to develop interdisciplinary teams, always depending on the available departments in their university. We are lucky enough to be in Aristotle University of Thessaloniki, which is the largest university in Greece. So in order to develop an interdisciplinary team, academics and researchers from different departments were involved. So academics from the School of Medicine and from public health sector, like myself, were involved in this project, and also people from our department that have a special interest in nutrition. Also, the schools of physical education and sports sciences were involved from 2 different cities, because Aristotle University of Thessaloniki has 2 different departments in 2 different cities of Central Macedonia. And also, we had the privilege to also work with the newly developed Child Rights Center. The coordinator, as already presented by Konstantinos, comes from the School of Philology, and she and her team represented the Child Rights Center within this group. The area for which the Aristotle University of Thessaloniki was responsible were 6 different prefectures in Central and Western Macedonia. So, what were the tasks that we should perform? The first one has to do with develop local partnerships. So mapping stakeholders was essential. And actually, this is an ongoing procedure, although it was the first step that we took when we were starting to see with whom we should work within the community. Adding stakeholders, something that actually takes place until today. We looked into different areas for the key players. So we've looked for the school community and the educational authorities, for the local governments, for the civil society, including sports clubs and associations and non-governmental organizations, health authorities, and also individuals from similar areas from the private sector. And until now, just to give you an idea of the numbers that were collected, we have a list of more than 250 stakeholders. Some of them were really actively involved in all these actions that I will present to you. Others were just in a list, not actively involved, but you can understand that this was the first step when starting to see how can we actually accomplish that. How we found the stakeholders? Looking at web and looking through the websites, official websites of the authorities was the first step. Of course, we also discussed about people we knew from previous collaborations. Emails were sent, and of course, sharing experiences with colleagues also helped to reach the right people. Something that I would like to highlight is that with some of them, especially the ones that were at the top of the hierarchy, both in with educational authorities and local governments, a very good practice was to actually pursue an in-person meeting, since these people were valuable in pursuing our goals. After organizing a list of stakeholders, the second step was to establish a regional task force. So looking into our list, we try to select the representatives, of course, from our team, the AUTh team, but also from the school community, the local authorities, the civil society, And actually, we were trying to select one person from each category for every one of the 6 municipalities that were within our region. This regional task force performed monthly online meetings at a scheduled day and time. It had a role in co-deciding and overseeing the implementation of activities, ensuring that the needs and the priorities were addressed. And also, it wanted to succeed in increasing networking among all these really important stakeholders. What we were planning, what we really wanted to achieve was to have an action plan. And we actually used an Excel sheet like the one that I'm sharing with you, writing down the name of each action, who was responsible for that, where it would happen, what were the different steps that we had to organize, and who was responsible for every one of these steps. Let me also highlight at this point that all the people that were involved in this regional task force were volunteers. Many actions took place all this year that the involvement of our team takes place. So we have already completed 39 actions, and a few more are organized for the near future. And it's really impressive to see overall that over 6,800 adults and 4,800 children participated in these different actions. And the actions that the regional task force organized were either organized on its own, or they were taking advantage of another event that was taking place, an event organized by the municipality or within the university. And we were trying, actually, all the members of the regional task force were trying to give information, to give leaflets, or also to organize activities for children or lecture for parents in order to increase awareness regarding both the existence of the toolboxes, but also regarding the healthy habits about nutrition and physical activity. Another thing that was among our duties in order to increase awareness among the educators, among the teachers, was to create some webinars for the teachers and also for the parents. So during this last year, we organized 3 awareness webinars for school counselors and educators, 5 online workshops, again, more interactive, longer in duration, and we actually try to focus and share with our audience tools that were coming from the toolboxes, and they were different for the webinars that were organized for primary school teachers and different for the ones that were organized for secondary school teachers. And actually, reaching the end of the program in the next month, we are organizing also one last workshop where we also intend to share with the participants the best practices from all those teachers that have been implementing the toolboxes for the last year. We also organized 4 in total workshops for parents. 2 of them were webinars, 2 were in person. Overall, we have reached over 1,000 participants through all these activities. Sharing with you some best practices, I have to say that these webinars that were organized were successful and very popular. First of all, I have to say that the brand name of a university, the University of Aristotle University of Thessaloniki has a really strong brand name, make these webinars really popular, especially among teachers. Things that we think that will really make them really successful, according to all the evaluations that we've got back was the fact that it included short presentations, and although they lasted 2 to 3 hours, they had interactive elements, and the other strength of everything that was actually done from our team was the interdisciplinary team that was involved. Also, asking for pre-registration was useful in order to know how many people we expect, although we've seen that about 40%, 30 to 40% may of those pre-registered will actually not join the actual webinar. In terms of what went well for educators, for teachers, I should highlight one thing that I would definitely recommend, that invitations were sent by email by the highest level of hierarchy in the school authorities, which was the Regional Directorate of Education for both Central Macedonia and West Macedonia, to all schools. So although we sent only one email, we knew that this email will reach with the best way all the schools in all these huge areas that we want to cover. So this was definitely a very good practice. And let me remind you that representatives of the Regional Directorate of Education of both Central Macedonia and West Macedonia were among the people that were included in the regional task force team. Another good practice was that we were giving a certificate of attendance, and this was a really strong motive for many teachers. Also, delivering these webinars during morning was something that was preferred by the teachers, although this was not feasible. It was feasible only for one group, for the counselors. So most of the webinars actually took place during afternoon hours, after 5 p.m. And the feedback that we had from the evaluation showed us that they were effective in increasing awareness. And this was also followed by an increased number of people who were actually registered at the toolboxes. In terms of parents and guardians, it seems that we have a different picture. Again, we've used the same tactic. We've sent the mails again by the Regional Directorates of Education. So the plan was that all the houses will receive by the schools the invite. However, we know that it didn't reach all schools and all houses, and the interest also coming from the parents were so much lower, and the numbers were so much lower. What else we did? That was really fun. We did some health festivals that took place last year in spring. So we took advantage of the annual event Aristotle University of Thessaloniki on Sunday, and we performed 2 different events with many playful activities designed for children. I say for the end a very small video that we have from that the first festival that we have. So this was also something else that we thought of doing in order to increase activity, to open the toolboxes to the community and invite parents and children at the university campus on that day. The last and important thing that we did in order to increase the awareness in the community was to create school hubs. Actually, we created, all the universities created 2 different school hubs within their region. We have chosen one in Thessaloniki, in western part of Thessaloniki, and one in Ceres. The first one we chose in Thessaloniki was in a middle school, while the second one in Ceres in primary school, because we wanted to test how the different level of education will work. We organized a program that was available, of course, free of charge for parents and children 2 days per week. And in order to make school available after the school hours, initially we decided to create a program that will be available after 5:30 p.m. The one day was dedicated to sport activities, while the second day had to do about how other behaviors that were within the program, including nutrition and healthy habits, could be achieved. We created a program different for each school, and that was shared through the mails of all the parents that were at those schools, but it was not restricted to them because all these activities were open for all the community. So we've also asked from the local authorities to share this program using their social media accounts. And it was highlighted that this is not only about the people living in this municipality. Many interesting stories could be shared. I share with you just a few pictures. I have to admit that all these activities were much more successful in the primary school that was involved. It seems that these aides and the parents of these aides and the teachers in the primary schools are more open to this kind of activities, while I'll also share with you these final photos, two photos from the middle school in Thessaloniki. It seems that at the age of a child at a middle school, a teenager, is more difficult to be involved, especially during afternoon hours. So I have to share with you that after trying to increase the people that were involved in these activities in the middle school, we decided to change the hour that all this program was happening. So we decided to create clubs and integrate these activities right after the end of the school program. And maybe in the future also integrating this kind of activities within the school program will be a very good way to increase the awareness in more students, and especially for the older ones, the teenagers. Again, sharing some experience, I have to say that participation, even in the primary school, was higher at the activities that involved both parents and children during the afternoon, not only parents and not only children. I would also like to highlight that the vast majority of parents participants were female, over 70 or over 80%. And this is something that we should also expect in this kind of actions. And overall, having an idea of how everything ran, it seems that the nursery and primary school, both teachers and parents, are more receptive to participating in such behavior changing interventions. Let me finish this presentation with the video that I've already promised. It gives really positive vibes. It comes from our first health festival, and I think that's really nice to close my presentation with that. I hope that you will enjoy it with me. So with this last slide and the smiles on the face of our interdisciplinary team, at the end of that day, I would like to thank you for your attention.
Thank you very much, Professor Tsimitsiou. Thank you very much. Congratulations on this very important initiative. This is a great program, and obviously you have done a lot of work with your team to set up this ambitious plan and engage all these different stakeholders. I mean, this is amazing. This is great work. This is exactly what public health is about, and we are very honored that you present these results for the first time to us here in Cyprus. I'm sure we will have lots of questions and comments after the presentation of Dr. Despoina Papadopoulou. So let's wait, the rest of us, for any comments or questions so that we address both of our speakers together in the end. So Dr. Papadopoulou, would you like to share your presentation?
Yes, of course. Can you see it?
Yes, perfect.
In full screen?
Exactly.
Okay. Okay, so first of all, allow me to also thank Professor Macris for this invitation. We're really honored. And I would like to say from the very beginning that I am really very happy that I had the chance to collaborate with this team from the Aristotle University of Thessaloniki, because all of us gained really a lot from this action, and I think that this was also reflected in the effectiveness of this project. So today I'm going to talk about the contribution of the Child Rights Center within the team of the Aristotle University of Thessaloniki for this specific project, which is the National Action Against Childhood Obesity. So first of all, I'm going to say very few things about the Child Rights Center in the Aristotle University of Thessaloniki. Then we'll move on to explain the child rights in academia, the role of child rights in academia. Then I will talk about the role of our Child Rights Center in the specific action, Food for Action. And then I'm going to focus more on why child obesity is a child rights concern. And I will conclude with child rights in action. So the Child Rights Center of the Aristotle University of Thessaloniki is operating at the university, but in collaboration with UNICEF, it was their aim, their aspiration to found such centers in different Greek universities, and we also have one in Thessaloniki. The aim of this center is to bring together scholars from different faculties, from different perspectives, and our mission is to promote research, teaching, and to disseminate knowledge on children's rights within academia, but also within educational units and in general in the community. What we find very important in our center is that it is inherently interdisciplinary. So as you see, we have colleagues from different faculties, actually from 5 faculties of the university. We have 3 members of the Faculty of Philosophy. We have 1 member from the Faculty of Health Sciences, Zoe, 2 members from the Faculty of Education, 2 members from the Faculty of Law, and 1 member from the Faculty of Theology. And this, the structure of our center reflects our understanding that children's rights cannot be approached from a single disciplinary perspective, but we need to approach this very complex issue from various perspectives, from various angles. I will say very few things about the role of child rights in academia. There is a lot of literature about this. Here, of course, the aim is not to focus on this issue, but what all studies have in common is that academics, policymakers, and practitioners they all play a separate, a distinct role in advancing children's rights. However, meaningful impact requires a dialogue between them. So the knowledge must travel in both directions, from research to practice and from experience, from lived realities back to academic reflection. So children's rights are inherently complex, and to address them requires not simply parallel disciplinary work, but a genuine integration of perspectives. This is particularly relevant when we approach phenomena which are very complex, as already pointed out by Professor Macris and also by Professor Tsimitsiou, like childhood obesity. So, as Professor Tsimitsiou already said, 2 representatives of the Child Rights Center of my university actively participated in the implementation of the Food for Action program. And our role was, first of all, to foster interdisciplinarity, secondly, to act as mediators between the academic team and the community. And this is because we both come from the School of Philology and we both have a lot of experience with education and with training programs with educators. So we could help the entire team to deliver the webinars that Zoe mentioned in a way that it is more, that is easier, more understood by the educators. Also, we introduced the Child Rights Center to the stakeholders so that they are aware of this new structure and they can also contact the structure in case they think there are violations of child rights. And what is very, very important, and today I'm going to focus on this 4th issue, our role was to raise awareness about child rights and the Convention on the Rights of the Child. As already mentioned in the previous presentation, childhood obesity is a very complex phenomenon. It cannot be reduced to individual choices or parental responsibility. Research has shown that it is shaped by a complex interaction of factors like, for example, food and commercial environments, psychosocial factors, access to preventive health services, etc. And children grow up within environments that they cannot control. So their exposure to food marketing, to the affordability of health food, to the availability of safe spaces for physical activity, the quality of school meals, etc. All these factors shape their daily choices. So when we recognize this complexity, then the discussion takes a different turn. The discussion shifts. Childhood obesity is no longer simply about the lifestyle, but it becomes a question of how well our systems, our health systems, our structures support children's rights to grow and develop in healthy conditions. And this is exactly where the Convention on the Rights of the Child becomes relevant. So when health professionals work to prevent childhood obesity, they are not only addressing a clinical condition, they're actively contributing to the realization of the Child Rights Convention. And in that sense, obesity prevention and in general, the fight against obesity is also the protection of the rights of the children. So I'm going now to focus on the specific articles of the Child Rights Convention, which are more relevant to the action, to this specific program, to the action against child obesity. So I'm going to start with two articles, which are the most relevant articles, Article 6 and Article 24. The first one recognizes the right of the children to life, but also to holistic development. And Article 24 guarantees the right to the highest attainable standard of health and, of course, access to healthcare services. It is important here to say that Article 24 explicitly mentions malnutrition. And today we understand that malnutrition includes both undernutrition and obesity. Both are very important. Here, of course, we focus on obesity. So when we take action against childhood obesity, this means that we promote the highest attainable standard of health, we prevent contemporary forms of malnutrition, and we ensure access to nutritious food, we strengthen preventive health care, we support healthy physical development, and we protect psychosocial well-being. The national action against childhood obesity with the toolboxes, with the toolkit Food for Action, as presented earlier in the previous presentation, is an attempt to promote healthy habits and to strengthen prevention by means of several services, some of which were mentioned by Professor Tsimitsiou earlier. So in this sense, efforts to prevent childhood obesity are not just health interventions, they are expressions of commitment to children's rights. Another article, which is very, very important, is Article 3. Article 3 requires that in all actions concerning children, and of course, also when we include public health policies or school regulations, etc., first we have to think about the child's best interests. So when public policies prioritize healthy environments, they operationalize this principle. So when we take action against childhood obesity, this means that we place children's long-term well-being above economic interests, for example. It means that we design school food policies based on health and not on convenience. It means that we regulate environments where children are exposed to harmful influences. It means that we ensure that public policy decisions consider children's future development. So when we design policies that promote healthy environments, we give practical meaning to the best interest principle. We prioritize children's health in this way. And as also shown in the previous presentation, the toolboxes attempt to provide all these issues. Now we will move on to Articles 5 and 18, which are also very, very important. Parents are primary caregivers and guides in shaping children's habits and children's daily routines. But parents should not be left alone in addressing structural health challenges. the states also need to support them. So when we take action against childhood obesity, this means that we equip the parents with reliable health information, we ensure healthy school environments, and we create supportive food systems. We also provide accessible preventive services. So public policy becomes a tool to empower families, not to replace them, of course. And when we support parents in promoting healthy lifestyles, is a core issue in child rights obligation. Now, if we look at the toolboxes within this national action, we see that there are specific activities which are designed for caregivers. Another important issue within the Convention of the Child Rights and within the specific action is the voices of the children. So here we talk about Articles 12 and Article 13. According to Article 12, children have the right to express their views, their opinions freely in all matters affecting them, and those views must be given due weight. And Article 13 states that children have the right to seek, to receive, and to have access to information and, of course, to ideas. So when we take action against childhood obesity, this means that we listen to children's experiences. It means that we understand how they perceive food marketing. It means that we include the children in discussions about, for example, physical activity spaces. It means that that the children have access to accurate and to age-appropriate health information. It means that we also give them information and actually education about media literacy and regarding food marketing. It means that they have the ability to discuss, for example, body image without stigma, etc. So effective obesity prevention respects children not only as patients, but as active participants in shaping healthy environments. In the toolboxes, we have several activities that aim to strengthen children's voices. As you see, for example, this is an example here from the toolkit where what we see is that the kids are asked to create a newspaper in order to express their ideas about healthy routines. And I'm going to focus on another article, and this is the final one. This is Article 28, which recognizes the child's right to education. And this article reminds us that schools are not only educational institutions, but also environments that shape health behaviors. So healthy school environments support learning in the sense that nutrition education promotes informed choices. Education can influence physical activity levels. It can help develop critical thinking about food marketing, and it can strengthen, in general, lifelong health literacy. And in the toolkit, we see that there are specific activities, specific toolboxes for educators, for all the levels of educators. And as Professor Tsimitsiou mentioned earlier, we also organized many webinars addressed to educators in order to empower them to face this very complex phenomenon, childhood obesity. So, to sum up, taken together, these provisions show that childhood obesity prevention is not confined to Article 24 alone. It engages development, best interests, parental support, the participation of the children, education, and living conditions. It is therefore a comprehensive child rights issue. It is a comprehensive child rights concern. So our role of the role of the Child Rights Center of the Aristotle University of Thessaloniki was actually to find a bridge between the Convention and the national action. So the Convention of Child Rights provides, we could say, the normative framework. The national action against childhood obesity provides the policy framework. The Child Rights Center's contribution was to bridge the two and to act as a rights-based lens when we implemented all these activities that were presented in the previous presentation. Our role was to ensure that the measures not only improve health indicators, but they also advance children's rights. Overall, we think that the involvement of the Child Rights Center was meaningful. We think that we promoted interdisciplinarity, and most importantly, we worked quite a lot with the entire team in order to contribute in raising awareness regarding child rights in academia and in general in society. Thank you very much for your attention.
Thank you very much also, Dr. Papadopoulou, for a very, I would say, very important and oftentimes overlooked issue of actually implementing and applying all of these important child right principles in our clinical practice, in our public health practice in the community. I mean, we tend to overlook these extremely important principles that should be guiding our everyday activities and actions, whether we are at the university or whether we are at the school as a teacher, whether we are a parent, whether we are a policymaker, whether we are a governor. So thank you for giving us this opportunity to be updated once again for this very important human child rights that we should not forget. So with no further ado, I would like to open the floor to give the opportunity to our audience to ask any question, to make a comment. The floor is, democratically open to everyone who wants to express an opinion or to make a question. Anybody? I mean, I have a question. Maybe I can start and then maybe the rest will warm up as well. So it is very interesting that, a linguistics professor and a physician actually get together. This is, I think, an example to apply in the future. And how eventually in the field did that work? And do you think that's something that you would like to continue applying and implementing in the future? Do you think it was an okay collaboration? Do you think maybe sometimes you felt it didn't work? Would you like to describe a little bit that experience?
I think that both Despoina and I should respond to this question.
Yes.
Let me remind you that we were physicians coming from the School of Medicine. We were physicians, epidemiologists, people, experts in nutrition from the Department of Physical Activity and Sports. We also had academics from there, and of course, Despoina and representing with her team representing the Children's Rights Center. At first, I have to admit that we were asked to work together because we didn't actually knew each other. And it was at the beginning a shock how we will work together. No one has done such a collaboration before. After the first few months, we realized that this was an amazing present, getting to know each other and all these dynamics of the team, things that we haven't considered before, because everyone has brought their experiences and their expertise, and this made a team that could achieve really high goals. And I definitely think that this is one of the most important best practices that have to be highlighted. Working especially in the field of public health with interdisciplinary teams is a secret of success. And we definitely want to continue collaborating in the future. I would really like to give the floor to Despoina.
Yes, thank you for this question. Actually, it was also a question we had at the beginning of this collaboration. As Zoe said, we were asked to collaborate, okay, because I am involved in several projects funded by UNICEF, and this is how I am also involved in the Child Rights Center. And actually, that was a wish that came from UNICEF. They wanted the Child Rights Center to participate in this action. And I have to say that I think that was a very wise decision, because we could add a dimension that was not present in the team. And that dimension was the child rights approach, to look at the issue from the child rights lens. And I think another important issue was that we worked as mediators between the specialists on health and the community. So, I mean, in a way, we try to fill this gap between the scientists on health and the community and the educators. And we really enjoyed this collaboration, and I hope that we can continue, especially now that we have this structure, the Child Rights Center, which is also an interdisciplinary structure. We hope that we will have the opportunity to collaborate more on this issue.
Amazing, amazing. Thank you very much for this input. It is also very inspiring for us as well here in Cyprus, and hopefully also in other parts of the region. So maybe we can try to ask our audience if they have any questions or comments, while I give you the opportunity to maybe think about the topic of sustainability, how this program can become sustainable after the end of it. So hold your thoughts on that, or maybe entertain these thoughts while we wait for a comment or a question from the audience. Anyone?
Hi, can you hear me?
Yes.
Hi, thanks a lot, both professors, for this presentation. It was really nice to see this type of intervention and how it worked, the collaboration between the two of you. I just wanted to ask about the part for the parents' participation, that it was low, and it's something that we also observe usually. Do you have any ideas how to maybe make this work better, or how to make them more involved in this? I don't know, maybe if we involve the Parents Association, maybe? I don't know, your thoughts. Thank you.
To be honest, we tried everything. So I think that we definitely have to use social media, for example, in order to spread the word. Just an email from the school is not enough, although it was more than enough for the teachers. And again, sharing the experience from school hubs, it seems that the parents of the younger children are expected to be more interested in all these topics. So, and also the mothers, also keep that, the mothers of the younger children. And what I also have to say again is that when we are having these actions after hours, the school hubs, the actions where younger parents with younger children had the opportunity to be together with their children, so entertain and also have something interesting and educational for the children, and at the same time be also there being part of this action. These were the most successful one. It's a difficult issue to solve. However, these were the strategies that we've seen that worked best. I don't know if Despoina, you have to add something based on our experience.
Yeah, I agree with what you said. I mean, if we talk about best practices, I mean, one practice we could use in the future is to incorporate some short interventions with the parents within school meetings, because we have this, the parents usually have a meeting within the school with all the teachers, to discuss several issues regarding education, the school, etc. And one idea would be to incorporate some short interventions about healthy routines, etc., within these meetings, because they come anyway to the school, they are there, so you can involve them also in an intervention regarding health.
Great, thank you.
Thank you. Thank you very much also for your insights on the topic. Any last, as the time is passing by, where I think time to start closing up. Any other question or comment? No? Maybe you can entertain a little bit my previous comment on the sustainability of the program, and then we can close.
This is a really important question, and what you want to see left behind, because when a program ends, you wish that all this effort and time and money aren't just wasted. So the hope is that all these people that were trained, and I really believe in the school community and the teachers that were trained could use all these, all the toolboxes and all these that they have acquired and put them in their everyday practice within the schools. There are so many opportunities during the school hours that they can use all these very interesting scenarios and ideas of how to change their environment, what to do in their classes, how to be role models for the children. So this is something that I could see happening in the time that will follow, and it was so such a pleasure to see that some teachers, especially from kindergartens, already in Western Macedonia have chosen to create clubs on their own. It was their own idea to create clubs using all this material for the toolboxes for the children that they have in their kindergarten. So I can see this kind of initiatives continuing this effort. And of course, we hope that the parents that listened about the toolboxes and all these initiatives will also take advantage of all this material and try to implement all the recipes and all the ideas of how to play with their children trying to give them the right message and try to implement them at home. This is what we hope that will stay after all these efforts.
Thank you. Thank you very much. I don't know if Dr. Papadopoulou would like to add something.
Just one line. One idea to maintain the sustainability within the schools is to use the clubs, the groups that already exist in some schools after school. Some schools have already done this. They have implemented several actions within these clubs, these groups. And one idea would be to continue this program in such groups. And I also agree with what Zoe said, and I think this is very important, that in this team, we raised awareness about child obesity, and also we showed how this can be prevented in a very clear way. And the toolboxes also present some very clear cases, a very smooth, I would say, way to incorporate them within the school curriculum. And this is very important, and I hope that we are optimistic that the educators are going to use them.
Thank you. I think that's a perfect pass to close the webinar with an optimistic tone and way forward attitude, hoping that things will continue evolving in a more positive way with your help, with your contributions. So Dr. Tsimitsiou, Dr. Papadopoulou, thank you very much for sharing your brains and your expertise regarding this topic today. It was very enlightening. And thank you on behalf of everyone here at the Institute and also our Children First Network. Thank you once again and congratulations. And thank you all for attending the webinar. Bye.
Thank you very much. Bye-bye.